Another question I get asked all the time, doctor, am I a good candidate for liposuction? And it kind of amazes me, since it's probably the #1 cosmetic surgical procedure that we do all across the nation. It's important to understand what is liposuction. Now, there are various techniques people use: ultrasonic, they use radio frequency, different techniques. I use a tumescent technique. So basically what that means is the area of fat that I'm going to remove, I tumesce it. I blow it up with fluid. This helps break down the fat molecules and the fat globules, and then I put a cannula in there. It's hooked up to a suction, and we remove it. Now, one of the things that I've learned over the years is I use smaller cannulas rather than bigger. When liposuction came on the scene, maybe 25, 28, 30 years ago, whenever it was, we used bigger cannulas. Now we use very small and tinier cannulas, so we can be more precise in the amount of fat that removed. Now, what's important with liposuction is to understand what it will do, what it won't do. What liposuction does, it debulks. It makes the fatty layer from here to here. So it doesn't tighten skin, it doesn't tighten muscles, it doesn't take away loose skin. It merely removes the soft tissue or fat between the skin and the muscle. So if you already have loose skin, guess what? We're letting more air out of the tire. You're going to have more loose skin. And I think it's amazing to me in my practice how many people come in not realizing that they get liposuction maybe done by somebody else, and they realize, geez, doc, it looks worse now because I got more loose skin. Exactly. So you need to understand what it will do and what it won't do. The other thing that's important about liposuction is, and I tell this to all my patients, it's not necessarily what you take away, it's what you leave behind. I've seen many people that have had overly aggressive liposuction, and on their tummy, their back, their flank, and they've got this ridging and grooving and dimpling and concavities, and it's, you know, it's horrendous, and it's almost impossible to correct. So I always tell my patients, we don't suck till the cows come home. We suck to what I consider a safe level, and then we stop. Now, many times suctioning will precede, for example, a tummy tuck. A woman will come in and she wants some contouring, so we'll suction, let's say, her back and her abdomen. Then she gets on a diet, exercises, loses another 20, 30 pounds. Then she comes in to have the definitive tummy tuck procedure performed. So liposuction is a good adjunct. We use liposuction, for example, to harvest fat, so that we can put fat in the breast or in the buttock or the face. We use liposuction to debulk in preparation for a tummy tuck. Sometimes people have a select area where they don't like the fat. Classic example, saddlebag. And I always tell people, genetically predetermined. Grandma had saddlebags, mom had saddlebags, I have saddlebags. Guess what? It's in the genes. It's not going to go away. Is there a way to correct it? Liposuction. So liposuction removes bulk. It doesn't tighten muscles, doesn't take away loose skin, it debulks. So it's important to understand when you go into a plastic surgeon that you have a basic understanding of what it will do and what it won't do.